For most people, wearing a face mask is a simple way to help prevent the spread of COVID-19. We at OPA strongly support efforts to reduce the spread by wearing masks. While we are all doing our part, it is important to appreciate that some populations, such as young children, those with disabilities, and marginalized communities, may face greater barriers to wearing masks. According to the Centers for Disease Control and Prevention, children 2 years old and younger should not wear a mask. Also, older children may face challenges to wearing a mask due to cognitive, intellectual, developmental, sensory, and behavioral disorders. The CDC also states that those who are deaf or hard of hearing may face additional challenges to mask wearing and may be unable to wear masks if they rely on lip reading to communicate. The CDC suggests wearing a clear mask or using other means to communicate, such as written communication, are possible adaptations for this population. Individuals with certain mental health conditions may face greater barriers to mask wearing. For example, people with intellectual or developmental disabilities, such as autism, cognitive impairment, such as Alzheimer's disease, and mental health conditions, such as schizophrenia. The CDC recommends that these individuals and their caregivers reach out to healthcare providers for advice about mask wearing. Individuals with pre-existing medical conditions, such as chronic respiratory problems, may also face more difficulty wearing a mask. The CDC suggests that those who have respiratory conditions who may not be able to wear a mask due to difficulty breathing should practice other means of reducing COVID-19 risk because of their increased vulnerability to the virus. Those in the Black community may experience more challenges and risks related to wearing face masks. One important consideration is that facial coverings are often associated with law-breaking activities and violence. Since research shows that Black Americans are stereotyped to be dangerous, see the shooter bias studies for reference, and implicit racial bias is inherent in racial profiling, wearing a face mask may increase the risk of unjust treatment for Black Americans. Because of this racial profiling, Black Americans may be more hesitant to wear a mask in public. Also consider that Black Americans are at disproportionate risk of having respiratory diseases. For example, the CDC's research on health disparities showed that in 2018, Black Americans were at an increased risk of asthma compared to white and Hispanic Americans. These respiratory conditions may make it more difficult to breathe when wearing a mask. Again, the CDC suggests that those who have respiratory conditions and cannot wear a mask should practice other means of reducing COVID-19 risk because of their increased vulnerability to the virus. As you can see, there are a variety of reasons why members of certain populations face additional challenges to mask wearing. For individuals in these populations who may not be able to wear masks, other measures are available to reduce the risk of spreading COVID-19, including social distancing, frequent hand washing, and cleaning and disinfecting frequently touched surfaces. It is our role as mental health professionals and contributing citizens of our community to recognize each other's needs and assist where possible when we see that individuals are not given considerations appropriate for their individual circumstances. We are all in this together, so we must learn from one another, grow together, and protect one another.